Thank you, Lonnie. And yes, let me call on our speakers for this panel to join me here. So, as Lonnie said, after the two outstanding keynote speakers, we're going to start. This is a first session, which this panel is part of. So it's addressing key gaps and needs in our understanding of microbial and genetic movements across the One Health domain. And so our first panel, with three distinguished speakers, we hope to look at current global and national antimicrobial resistance surveillance programs that incorporate One Health approach and dive into what can we do to improve our understanding of microbial and genetic movement across the One Health domain to guide actions. And the key here is action, actionable data. I come from the CDC where data is our bread and butter. Increasingly, it's actions. What do we do with this data? So on the human health end of spectrum, we are with antimicrobial resistance. We have increasingly prioritized systems and data that gives us situational awareness and allow us to more quickly detect and respond to emerging antimicrobial threats. So in this session, we're going to start with NARMS, the National Antimicrobial Resistance Monitoring System. It's a 20-year system, a very successful One Health collaboration between USDA, FDA, and CDC. And we will look at the successes of NARMS, but also examine opportunities. What can we do better or different? And then we're going to move with our second and then third speakers to dive into quality and gaps in surveillance systems and what, again, is needed for more critical and immediate action. And then getting the third pillar of the One Health, which is the environment. When we say One Health, more often we've been focusing on human-animal. The environment is important as well. So without further ado, let me introduce our first speaker, Dr. Patrick McDermott from the FDA. He's the director of the National Antimicrobial Resistance Monitoring System, NARMS, there. He has been working in studying antimicrobial resistance for 25 years, and he's held a number of leadership positions at FDA with the Center for Veterinary Medicine for a number of years. And Dr. McDermott.
Thank you very much. Thank you, Dr. Rauman and the Forum Committee for the invitation to join this important discussion today. I've been given a fairly large task to achieve in a few slides that are listed here. And by necessity, I'll probably have to go fairly quickly and touch fairly lightly on each of them in turn. But these questions are, what are the key findings of NARMS and lessons learned in 20 years? What's the value of One Health surveillance systems such as NARMS? What actions have been taken based on the data? What are the challenges? How have they been overcome? What can be learned to inform other systems? And what is next, including the question of whether we can measure the new policies that have removed production uses of antibiotics in U.S. animal agriculture. So we're speaking in terms of One Health. Before One Health, the term was integrated surveillance, and WHO's AGISAR committee had defined integrated surveillance as shown here, the coordinated sampling and testing of bacteria from food animals, foods, and clinically ill humans, and the subsequent evaluation of resistance trends throughout the food production and supply chain using harmonized methods. And so technically, to make this a definition of One Health surveillance, we would add to this the environmental component. And as mentioned, that'll be something that will be part of this discussion. What does that look like? Is it biosolids? Is it surface waters, near use environments, and so on? And how do we design that sampling to get the best information from it that is actionable? And so, as mentioned, NARMS has been around for 20 years, since 1996. It is a collaborative effort of the CDC, the USDA, and the FDA. It is looking, as the definition above implies, is looking using harmonized methods at resistance in the major foodborne bacterial pathogens. And at its outset, NARMS was designed to try to estimate the potential public health consequences of agricultural antibiotic use. And so we try to look as much as we can from farm to fork, as they say, But we look at the farm or the ag aspects by looking at slaughterhouses. And I do want to point out that since 2014, we did modify NARMS substantially, and USDA was absolutely instrumental in moving from the HACCP-based sampling approach to now a system that has randomized nationally representative sampling of food animal production in the United States, which is no small achievement. And it's a data set that's showing us new insights into the ecology of resistance. And then at FDA, we're working with state partners to sample the retail meat supply. So CDC currently, in terms of salmonella, does susceptibility testing on every 20th salmonella that the states collect, but are poised in 2018 to be doing whole genome sequencing on hopefully every single isolate of salmonella in the country on an annual basis. And I'll try to touch on what that means for our surveillance system going forward. So the question of the value of One Health surveillance is really hard to overestimate, and I think because the value of it is so immediately obvious, it is foundational to all the national action plans and to WHO's recommendations to building a One Health surveillance or One Health effort to address antimicrobial resistance. So the value is you get an understanding of baseline levels of resistance in different reservoirs, and keep in mind not just resistance, but the pathogens under surveillance as well. Information to describe the spread of resistant strains and genes across ecological or ecosystems through bottlenecks, et cetera. Trends in those resistances findings, which is really fundamental. We want to know what's changing over time from different sources, and with special emphasis on antibiotics that are more consequential, or resistance is more consequential to effective treatment of foodborne illness. It allows one to generate hypotheses about the sources and reservoirs of resistant bacteria and try to attribute them to certain practices that would allow interventions to be more targeted and informed. It helps to understand the links between use practices and resistance. Now, there's a lot that could be said about the gaps between what we know about annual drug sales, for example, and how that might be associated with resistance, but there's a continuous effort to get better use information. It provides information on the burden of illness, BOIs, burden of illness, related to resistant infections and what different outcomes might be related with resistant strains as opposed to susceptible ones. A key component that's been brought up already by Dr. Fukuda and others is it gives data to make decisions, to take action, to inform people who are in the best position to act on the data to try to mitigate resistance when unwelcome trends are identified. Obviously, there's an important part to developing policy and having a solid scientific basis for making decisions on judicious use or regulations around permissible uses in egg production. At FDA, NARMS data are really central to the regulatory process, both in pre-approving new animal antibiotics, where it provides data on the levels of resistance in food and different animals and the mechanisms mediating that resistance, which is part of the qualitative risk assessment process outlined in GFI 152, one of our guidance documents, but also, of course, post-harvest when, and there's a couple of instances I've listed here where resistance has become serious enough that regulatory action is made post-approval to either restrict the use of antibiotics in the case of cephalosporins, or an extra-label use prohibition was based partly on NARMS data, or to withdraw the fluoroquinolones for use in poultry. And then to evaluate these and other types of interventions, did they have the intended effect, which we'll get to again in the next policy event. And then back to number one, you've done something, you've acted on the data, hopefully you've established a new baseline that reflects the intention of the intervention. The challenges, I've listed a few of them here. Doing this type of work is expensive and laborious, and it does take commitment from the government and public health sectors to pursue this and to sustain this type of surveillance over time. A sound sampling scheme along the food chain and now also the environment is critical for valid analysis of the data and changes you might observe. Collaboration and data sharing between, and this is the One Health collaborative part, is the agricultural sector, industry, public health sectors, and different subject matter experts within and across sectors. That's more difficult than it may sound, and I know in some countries that's probably been the major impediment to successful One Health type surveillance is difficulties in overcoming some of these the different silos in which government agencies may find themselves sometimes. Establishing a process for review and enhancement is critical, and NARMS is currently being reviewed by a subcommittee of the FDA Science Board to give us recommendations on how we might make it a better system and fit for its purposes. Publishing complex findings to different audiences in a timely manner. This is something we've put a lot of effort into lately. A lot of people are interested in the resistance challenge for different reasons, and to try to reach all these audiences with understandable information is a continuous challenge that I think we've made some good progress on, actually. Obviously, it's a challenge to use the data to formulate sound public health policy, what constitutes sufficient evidence. We heard again about how often the claim for more evidence is a major cause of delay. And then international harmonization and cooperation has never been more important than it is now. So what have we learned? I didn't quite know what to say about what we've learned in NARMS, but I thought I'd start at the biggest picture. We know the resistance differs by serotype. For whatever reason, some salmonella are very adept at acquiring MDR plasmids, whereas others, like Enteritidis, at least in the US, spit them out and don't seem to accumulate much multi-drug resistance. But if we look at the overall picture, which is shown here, the top line shows the whole history of NARMS and the proportion of human salmonella isolates that aren't resistant to any antibiotics on the drug panel we use, which has 15 drugs on it. So since we began in '96, susceptibility pictures steadily improved for 20 years. If you look at the human isolates and you look at all serotypes combined. There are serotypes within these data that go up and down, and some are not improving. But overall, that's the general picture. And if you look, as you might guess, at multi-drug resistance, it's gone down. And then resistance to critically important antibiotics, which is a category that's widely used now in the risk assessment process. In this case, ceftriaxone, azithromycin, and ciprofloxacin. Only ceftriaxone resistance is material in the human isolates when we look at it. So when we look at the most important drugs in resistance in human cases of salmonella in the US, it's not, the situation with exceptions by serotype is not all bad news. Now in 2014, it was possible for the first time to look across other surveillance systems, and this shows how the US compares in resistance to critically important drugs with what's coming out of the ECDC and SVAC reports. And at the very end there, you can see the US data, but it shows that resistance to the quinolones and third-generation cephalosporins is comparable to what's going on in the best situations in Europe. If we look in broilers, and this 14 was the first year we had broilers, you can see that I would suspect the withdrawal of poultry fluoroquinolones in 2005 has kept ciprofloxacin out of our broiler meat supply, but you can see a range of different levels of resistance across EU countries. Anyway, and this is the non-critically important, if you will, the more common antibiotics, where the US situation in humans is pretty good comparably, and in broilers about the same as the average of the member states. So this is important. This is the first point of surveillance, is what are our baseline levels. And in this case, it's generally a pretty good situation, but the goal is still to drive resistance down, as Dr. Fukuda said, to the lowest sustainable levels. And so when ceftriaxone resistance hit 4.3% in the human population, the FDA put the extra label use prohibition in place, and it's gone down since then. In human isolates, it's gone down in animal isolates. And so other countries have seen the same thing with these extra label or these prohibitions against third-generation cephalosporin. That is one case where it does seem to have a measurable and fairly immediate impact, and we're watching that closely to make sure it continues. Sequencing is changing how we're doing everything. Sequencing is giving us comprehensive genomic information, including all of the genes involved in resistance, and it's making laboratory processes much more streamlined. And it works really well at predicting resistance in the target pathogens in NARMS. And we and others have done studies showing that it's around 98 to 99% of the time, if you have a clinically resistant strain of salmonella, it'll have a known resistance determinant associated with it, just looking at breakpoints, correlating breakpoints with known genes. And similarly, if it's susceptible, we do see silent genes, but generally a pretty good correlation for most drugs. So overall, sequencing is a pretty good surrogate for in vitro susceptibility testing, traditional methods. And what does it show us? I mean, I like showing this slide because this is 10 years old, but it shows us the importance of the One Health perspective, if you will. It shows us, you can see in some modern strains, the whole history of antibiotic drug use with the accumulation of resistances on single a single plasmid that has gained ascendancy and now is fairly widespread in U.S. U.S. agriculture. This plasmid backbone that's shown here is identical, 99% identical to a plasmid from a child in Madagascar who had plague in 1997. So the One Health isn't just a national issue. This is clear data that it's a global One Health approach is what is needed. These plasmids get around the world quite readily, and those that are able to accumulate resistances do so quite readily and spread to different pathogens within the family. I don't have time to show you about the data presentation, but I would say go to our website and look at how we're trying to make all this genomic information available. And soon we'll have a tool that will allow you to track resistance and everything submitted to NCBI in almost real time. So the last bit here to touch on is the new policy. So you may know beginning in January of this year, it's no longer legal to use antibiotics in food animal production for growth promotion or production purposes. And the classes affected by this policy are also classes tracked in the NARMS program. And we, of course, do have now this new sampling by USDA. It's giving us representative randomized data from food animal production. It's suitable to the scale of U.S. animal ag. So we have from there the major bacteria tracked in the program, but we're also trying to take advantage of the latest metagenomic technologies. And so we have kept every single animal sample since this program began and are reducing them all down to their DNA constituents and looking at them with metagenomic sequence analysis and trying to see if that, we can't think of a more sensitive way to try to measure the impact of this policy. And then to combine this information with the phenotypic data, as I said, from the pathogens themselves. And we'll have some 25,000 samples processed. And we're starting to get a pretty good picture of sort of the pre-policy baseline levels at the metagenomic level. So this shows, you know, different sample sources, but the average of these sample sources of different resistances from different food animal sources. And we're hoping that these baselines will be a reliable reference point for changes that started in January of this year. Like I said, we don't honestly know how well it's going to work or if it's going to be sensitive enough, but we don't know how to be more sensitive in our approach. We are starting to get pretty good information on specific resistance alleles associated with different animal classes as well. So, we've worked hard over 20 years to always improve NARMS, to make it more fit for its purpose, to get better data, make it more reliable, make our trend lines indelible, even if we don't always understand what's driving trends one way or another. But of course, especially with the One Health paradigm, there are gaps in the design of the surveillance system, which we're trying to address and hope to address. And some of, excuse me, some of them are listed here. We don't have an animal pathogen component, which is really, if you think about it, an obvious and missing piece of the One Health approach. Resistance is a problem with animal pathogens as well in food animal production. And so we would like to find a way to make that part of our national surveillance. We don't have a companion animal component, obviously, and I'm not sure that any country's really successfully stood up an ongoing surveillance system that measures resistance that might be entering the human population from companion animals, where essentially any antibiotic can be used. There are no extra label use prohibitions in companion animals. So I think that's an important missing piece. There is some data suggesting VRE actually originated in dogs before it became a problem in hospitals. We talked about the environmental piece and what that might look like to complete sort of the third part of the One Health platform. Broadening collaborations with other agencies and taking advantage of other existing data sources. Continuing to work internationally, I think that's key. And we really are pushing for open data sharing. You can go to our website and download all of our isolate level data. To the beginning of the program, some 160,000 isolates, and we're going to be pushing out the genomic sequence as fast as we can get it. I think we'll probably have like 7,000 or 8,000 isolates with all the phenotype data, all the genetic sequence data available publicly at NCBI. And we hope other innovators will take advantage of it too, who are trying to develop new antibiotics. I think we are moving towards microbiome type surveillance. There's a lot of things driving that. We can talk more about that if you like. And then again, as Dr. Fukuda said, a big missing piece is what's appropriate action based on what you see, especially now that we essentially are seeing everything. I mean, we've seen deeper than ever before with the genomic approaches, if we, if we see imp27, for example, which showed up in a recent study of an Ohio swine production facility, what does that mean? What's appropriate action to try to keep that from becoming a greater problem? So we're sort of a victim of the technology in the sense that we have data so comprehensive and complete now that the action piece is going to take a lot of circumspection, I think, both in understanding what an individual finding might be and what's an appropriate action. So I hope more thought will go into that, because a lot of times saying we have a problem to farmers who would like to know what to do about it, and we don't always have the best answer is an important part I think we should be addressing. And I'd like to acknowledge the many, many people involved in NARMS, and I know this was a quick flyover, but hopefully it's good fuel for the conversation about getting good data to take scientifically sound action. Thank you very much.